As CACs begin to explore what their mental health therapeutic options are, you have to start someplace. And one of the best places to start, I think, if there is not a program in place already or not a robust program in place, is who are the providers in your neighborhood. And really, whether it's using a staff member or using an intern, but begin to take an assessment and looking at the different guides and going to the different meetings and finding out who all the therapy providers are in your community. They're not necessarily always going to be at your large children's hospitals or well-known institutions. That there may be small individual providers that are available to do this. There may be people operating under other programs that may be able to do this there. And therapy really is that great opportunity for any CAC to become a community collaborator. So I think really one of the first steps that any CAC can do when establishing these mental health programs is find out who's available and have an open house and bring them in. And that as your CAC staff is going out in the community and doing various works, as we're discovering mental health providers, is inviting them to become part of our collaboration there. I think the goal of the CAC should be able to host the collaboration, to find out who the providers are, and there are always going to be new providers coming in, and there's always going to be providers leaving. And so it's up to us to maintain that list of who's a good provider that's available. I think the other thing that a CAC needs to do when looking at these programs is how many families are receiving therapy? That if you're running your own program and you've got your own therapist, but only 25% of your population's getting the help that they need, well, then how do we fill that other 75% gap? Some of that can be filled internally if you're hiring people, but I think that there's no point in reinventing the wheel. We've prided ourselves as CACs on building an efficient model, and that means also not doing all the work that's being done out there already. There's good work being done by other mental health providers. So how do we bring them into our network to then help close that gap?